Welcome back to our deep dive. Today we're tackling something that, well, it really hits close to home for everyone. There's so much discussion, even controversy swirling around disease outbreaks globally. It's easy to feel overwhelmed, right? But these events, whether we like it or not, they really do affect us as a global community. So today we're going to unpack why it's so important for you and me to actually know what's happening across the world, why more research is absolutely crucial, and why it's just vital to keep asking questions and, stay aware. We've pulled together some really fascinating sources. We've got insights on contagion scales from the Week magazine, the European Parliament's briefing on the economic fallout from pandemics.
That's a heavy hitter.
Definitely. Plus deep dives into the lessons learned from SARS, some tough lessons there, and even the U.S. government's latest global health security strategy. Our goal here is pretty straightforward. Cut through the noise, deliver the key insights, and help you really grasp how diseases spread, the ripple effects, and importantly, what's being done to protect us all. Okay, so let's start with the basics. How do these things actually spread? This idea of R0 or R0 seems, well, pretty central. What really struck you about how the sources explained R0 beyond just the number?
Well, what's fascinating is just how clearly we can quantify a disease's infectious power. R0, it tells us the average number of other people one infected person is likely to infect. If that number pops above 1, the disease spreads. If it's 1, it's kind of stable.
Right.
And less than 1, it usually fizzles out. Think of it, like a chain reaction, the movie Contagion. Many people watched it again during COVID. Right?
Yeah, I remember that.
It got a lot of praise for its scientific accuracy, and it highlighted R0 perfectly. It also really brought attention to fomites. Yeah, everyday things, doorknobs, elevator buttons, water fountains, stuff that can silently carry infection.
Okay, that makes it very real. So let's talk numbers. Which diseases did our sources flag as the fastest spreaders, the highest R0 values?
Right at the top in terms of pure contagiousness is measles. It has an R0 between 12 and 18.
12 to 18, wow.
Yeah, it means just one infected person through only 2 rounds of transmission could lead to something like 342 people getting sick.
342? That's staggering.
It's incredibly virulent, spreads through tiny airborne particles, coughing, sneezing. They can hang in the air for hours. An unvaccinated person could potentially catch it just by walking into a room where someone infectious was maybe 2 hours before.
Just walking into a room.
Exactly. And its recent comeback, even in places like the UK and US, seems largely linked to drops in childhood vaccination rates. Things like the COVID pandemic disruptions, global conflicts, and sadly, misinformation about vaccine safety have all played a part.
Okay, that's measles. What other diseases pack a similar punch with high R0 values?
Well, others include pertussis, that's whooping cough. R0 is around 12 to 17.
Also very high.
Yep. Chickenpox is up there too, 10 to 12. And COVID-19, though it varied a lot by subtype, generally fell somewhere between 8 and 12. And while, many people recover from these, they can all cause serious complications. Pneumonia, seizures, meningitis, even blindness or death in some cases.
So high R0 clearly means fast spread. Got it. But what about diseases with lower R0s? Does that automatically make them less dangerous? Or is there more to it?
That's a really important point. A lower infection rate definitely doesn't mean a disease isn't dangerous. Take tuberculosis, TB. Its R0 can be less than 1 or up to 4, depending on things like living conditions, healthcare access.
No way.
It's airborne, but it spreads more slowly. Usually needs prolonged close contact. The real kicker with TB is the treatment. It needs a cocktail of 4 antibiotics for at least 6 months. And standard stuff like penicillin, useless. Plus, and this is really concerning, drug-resistant TB is on the rise, makes it a persistent, deadly threat. Ebola is another example. R0 is lower, maybe 1.5 to 2.5, but it's highly fatal.
They're very scary headlines with Ebola.
Exactly, but it spreads through close contact with bodily fluids, not through the air like measles or TB. And then you have things like MERS, bird flu, leprosy. Their R0 values are actually below 1.
Less contagious then.
Less contagious, yes, but their severity, the potential complications, you just can't underestimate the threat. R0 is just one part of the whole picture.
Okay, understanding the spread is critical. But let's shift gears a bit. Beyond the immediate health crisis, these sources really hammer home the huge economic and societal impacts. It's not just about people getting sick. It touches everything, our daily lives, global trade. What did that European Parliament briefing reveal about these wider impacts that maybe surprised you?
Well, taking that step back, you really see the ripple effect. It goes way beyond the health statistics, right into the fabric of our economies and societies. The spread of a virus can trigger massive consequences for national, even regional economies. Forget just the tragic loss of life for a moment. The economic channels are incredibly diverse.
Like what?
Health systems get overloaded, transportation gets disrupted, agriculture, tourism, international supply chains, they can all get hit hard. And factors like, rapid urbanization, more international travel, climate change, they all make these outbreaks global problems, not just local ones.
So can we put some numbers on this? What's the scale of the economic damage we're talking about here?
The figures are pretty sobering and they really highlight inequality. One estimate we looked at suggested a severe global flu pandemic, like the 1918 one,
Okay.
could cost around 500 billion US dollars per year. That's about 0.6% of global income. But here's a key thing. It hits lower middle income countries way harder. Losses could be 1.6% of their national income compared to maybe 0.3% for high income countries.
Huge disparity.
It's massive. And a WHO World Bank report put the potential cost even higher, up to 3 trillion US dollars, or nearly 5% of global GDP. And consistently, the data shows vulnerable populations, especially the poor, suffer most. Less access to healthcare, fewer savings to fall back on.
It hits the most vulnerable hardest. Okay. What about specific industries? How do these economic shockwaves actually travel through our economy?
Well, the health sector is obviously ground zero. Surges in hospital admissions mean huge costs. But beyond that direct cost, the ripple effect is vast. Think about containment measures, closing schools, restricting services. That has a massive economic toll. Lost workdays, lost productivity.
Right, people can't work.
Exactly. One study on the 2009 H1N1 flu in Chile estimated a $16 million loss just from missed workdays. Extrapolate that to the US, it was billions. And during SARS back in 2003, consumer spending just tanked in places like Hong Kong and Singapore. Supply chains seized up. What's also striking is how it reaches into seemingly unrelated sectors. About 60% of emerging infectious diseases are zoonoses.
Meaning they jump from animals to humans.
Precisely. So the agricultural sector faces huge risks and costs. Remember the BSE crisis, mad cow disease in the UK?
Vaguely, yes.
That cost around $3.4 billion. Or a Rift Valley fever outbreak in Somalia, livestock exports dropped over 75%. That's over $300 million lost for an economy that heavily relies on it. And even countries not directly hit feel it. The 2014 Ebola outbreak in West Africa led to a $1 billion drop in U.S. exports to that region.
And I imagine tourism and travel just grind to a halt.
Oh, absolutely. They get hit immediately and, frankly, catastrophically. H1N1, Mexico lost almost 1 million overseas visitors. That's nearly $3 billion in losses.
Wow.
MERS in South Korea, 2.1 million fewer visitors, 2.6 billion lost in tourism revenue. SARS alone cost billions in domestic tourism in China and Malaysia. Even air travel, Asia Pacific Airlines lost something like 8% of their annual revenue, $6 billion. During SARS in 2003, it's just devastating for those sectors.
The financial toll is clearly immense. But what about the costs that aren't measured in dollars? The sources also mention significant psychological impacts, the human cost beyond illness.
Yes, absolutely. And COVID-19 really brought this home globally, didn't it? It's been described as a major stressor, almost like a natural disaster or a war. We saw huge increases in anxiety, depression, sleep problems, and even, disturbingly, a rise in domestic violence. One figure mentioned a 45% increase in India during a lockdown, hitting marginalized communities hardest. A lot of the psychological burden was driven by economic distress, too. Job losses, pay cuts.
Makes sense.
And think about education. Over 1.7 billion learners affected globally by school closures. It highlighted the digital divide, put huge stress on parents, especially women. It really shows that an outbreak isn't just physical. It's a deep assault on our collective well-being, touching every part of life.
That paints a really stark picture of our vulnerability. Okay, so given all this, what did the sources say about preparing for the next one? What did SARS teach us, particularly about research during a crisis?
Right. Well, SARS, despite its awful impact, 8,500 cases, nearly 800 deaths, $90 billion economic hit, it was a huge learning opportunity for rapid response research, the biggest lesson. Traditional science timelines are just too slow for these fast-moving threats.
Why?
Canada was hit hard by SARS, and they set up something called the SARS Accelerated Vaccine Initiative, or SAVI. The goal was simple: develop a human SARS vaccine as fast as humanly possible. They got funding in April 2003, about 2.6 million Canadian dollars, and managed to get 3 vaccine candidates ready within 6 months.
6 months? That's incredibly fast.
By
How?
basically adopting an emergency management approach, they ran research strategies in parallel, not sequentially, and shared genomic data incredibly quickly.
Okay, that sounds like a game changer, but surely they hit roadblocks trying to move that fast. What were the biggest hurdles and what kind of innovative solutions came out of it?
Oh, definitely hurdles. They tackled big issues head on. Intellectual property, for example. Normally a huge bottleneck, right?
Yeah, definitely.
Asafi's approach was basically to leave ownership with the inventors and universities. It actually sped things up by encouraging sharing. Regulatory issues, too. They had direct talks with Health Canada, the US FDA, to map out rapid approval steps, though, the urgency faded a bit as SARS cases dropped off. But maybe the most revolutionary part was funding. Forget waiting a year or more for grants. SV used a rapid review process. They could get funds out the door within 24 hours of getting a proposal.
24 hours. That's unprecedented.
Absolutely, a massive shift. And the other critical lesson, maybe the critical lesson, was the absolute need for international collaboration. The WHO was central coordinating responses, organizing meetings, tackling global issues like IP and regulations. That unselfish collaboration seen during SARS, where labs worldwide shared everything without worrying about ownership first, that's what allowed them to pinpoint the virus so quickly. It really showed what's possible when everyone pulls together.
That really does point towards needing a more collaborative future.
So building on those lessons, what are the big global efforts happening now to strengthen our defenses? You mentioned the U.S. Global Health Security Strategy.
Right. If we look at the current global picture, the overarching vision is pretty clear. A world where everyone, everywhere is protected from health security threats, especially infectious diseases. And these threats could be natural, accidental, or even deliberate. The strategy is all about boosting prevention, detection, preparedness, and response. COVID-19 was a brutal reminder of why we need a much stronger global health security, or GHS, architecture. The idea is simple: contain outbreaks at the source, protect everyone. This U.S. strategy has 3 main pillars, basically. First, strengthen capabilities directly in partner countries. They're aiming to help at least 50 countries achieve demonstrated capacity in key areas.
Like labs and surveillance. Exactly. Lab systems, disease surveillance, tackling antimicrobial resistance, things like that. Second, boost political will, funding, and leadership globally. This includes establishing the Pandemic Fund at the World Bank, something the U.S. pushed for to invest specifically in preparedness.
Okay.
And third, connect health security better with other programs. Because GHS doesn't exist in a vacuum, right? It relies on strong overall health systems, stable economies, food security, even environmental health. So it means leveraging existing big programs like PEPFAR for AIDS relief, the President's Malaria Initiative, water and sanitation projects to build broader resilience.
So it sounds like it's not just about governments talking to each other. It's a whole of government thing, but also whole of society and international teamwork. That sounds incredibly complex to manage.
It is complex, absolutely. But that's precisely the point. It requires cooperation across all sorts of sectors. It emphasizes science-based approaches. And importantly, country ownership countries need to lead their own plans. It also explicitly commits to equity and inclusion, trying to break down barriers so everyone can access services. And right now, negotiations are happening for a new pandemic agreement and updates to the international health regulations. These could really set a shared path forward. But you're right, it's not just governments. It has to involve civil society, the private sector, academia. Everyone has a role to play.
Wow, what an incredibly detailed deep dive. We've gone from the R0 number, something almost microscopic, all the way up to these huge macroeconomic impacts and the global strategies trying to prepare us. It really underscores how interconnected everything is. An outbreak anywhere really can impact everyone, everywhere. It seems so clear that things like vaccination, strong public health, and continuous rapid research are really our best lines of defense. So for you listening, I think the key takeaway is this: staying informed, understanding these complex dynamics. It isn't just, academic. It's a really crucial part of being a global citizen today, because the experts agree the next pandemic isn't really a question of if, but when. So what does this all mean for us practically? I think it means recognizing that every dollar invested in global health security, every research project, every effort to fight misinformation, it's genuinely an investment in our shared future. It means we need to empower ourselves with knowledge, even about stuff that seems far away or frankly controversial sometimes. Because that awareness, that's the first step towards building resilience.
And maybe that leaves you with an important question to think about. In a world where, as we heard, one measles case can spark 342 infections, and a new virus can wipe trillions off the global economy, how can each of us, in our own way, contribute to building that global culture of preparedness, of critical thinking? How do we make sure the hard lessons from the past actually protect our future?
A really powerful thought to end on. Thank you for joining us on this deep dive. Until next time, keep asking questions, keep learning, and keep diving deep.